This is our group project for leading change for the issue of managing chronic illness. A chronic illness is defined as a physical or mental health condition that lasts more than 1 year and causes restrictions or ongoing monitoring and treatment. Some examples of chronic illnesses include cancer, diabetes, hypertension, respiratory diseases, obesity, and oral diseases. These diseases can cause hospitalizations, long-term disability, and even reduce life expectancy. They are the leading cause of death in the United States, but there are ways to reduce your risk, including eating healthier foods, exercising, quitting smoking, and just knowing your risk. According to researchers for the American Journal of Medicine, chronic illnesses are responsible for 7 out of 10 deaths in the United States. Across a 5-year time span, the number of Americans with new chronic illnesses increased by 1%, which is equal to 8 million people. There has been a 10-year increase in out-of-pocket costs for Americans with chronic illnesses. In 2005, at least 43% of Americans self-reported having at least one chronic condition, and 1 in 5 people have 2 or more conditions. Age, sex, race, ethnicity, and poverty status, as well as geographical, social, and cultural influences impact health and the susceptibility to chronic illnesses. Some populations are more likely to have chronic illnesses and need more help. With the changes that we implement, we would like to see a reduction in overall and individual healthcare spending. There would be a reallocation of spending from treatment to prevention. There would be fewer people engaging in risk behaviors, which include poor nutrition, lack of physical activity, tobacco use, and excessive alcohol use. There would be fewer new cases of chronic illnesses and better management of current chronic illness cases. There are several root causes for chronic illnesses. Some of these are modifiable risk behaviors, and others are non-modifiable factors. Risk behaviors that can be changed on a personal level include eating a healthier diet, increasing physical activity, quitting smoking, and reducing alcohol consumption. But some non-modifiable factors include age, sex, race, and ethnicity. And some factors are entirely out of a person's control, like socioeconomic status, environmental, political, and cultural factors. These non-modifiable factors require global and cultural shifts that could take time. According to the World Health Organization, risk accumulation is actually the largest non-modifiable factor of chronic disease, meaning that having multiple risk factors is actually a bigger influence of someone's risk of having a chronic illness than having one of the worst risk factors. Our 4 main recommendations are a focus on preventative care, an increase in public health, an increase in healthy lifestyle, and a reduction in cost. Seeing a physician on a regular basis can help patients to learn about their individual risk factors and prevent chronic illnesses from happening. Public health officials can help in determining social and cultural disparities, educate the public, and promote vaccines and a healthy lifestyle. Healthy lifestyle includes healthy food options, like having grocers offer sales and promotions on healthier foods, increased physical activity, and smoking cessation. And multiple visits and specialists and traveling for visits, especially for rural populations, is taxing. A reduction in cost to those, as well as fresh food and healthy options, can drastically change chronic illness. Research for the International Journal of Environmental Research and Public Health found that 40 million cases of chronic illness could be prevented by regular preventative care alone. In the implementation of our plan, we'll be especially focused on low-income and underserved communities. A focus on prevention is effective. It can increase the prevalence of health promotion practices and decrease risk behaviors. Detection of disease early can help avoid complications, comorbidities, and multiple chronic illnesses. Using telemedicine for chronic illness patients can provide low-cost preventative care. It can increase the access, especially for underserved populations. The results that we expect from regular follow-up visits for chronic conditions are an increased prescription drug efficacy, the ability to quickly address worsening conditions, and clarifications on test results, because confusion can lead to injuries. It enforces an understanding of long-term goals and creates a care plan between physician and patient. There would be fewer new chronic conditions and hospital admissions. Ways for providers to evaluate chronic illness improvement are to provide and receive CDC statistical reports of chronic illnesses. Organizations can also create reports based on ER admissions and physician office visits. And the following methods are also results. And changes in insurance laws and increased utilization of telemedicine are both ways to improve chronic illnesses and results that are expected from our changes.